I'm Jim Anson. I'm the Medical Director of LCL and have recently been appointed as the Clinical Director of Cheshire and Merseyside Pathology Network. So the network is all the pathology providers within a certain footprint within Cheshire and Merseyside coming together to work collaboratively, looking at the assets that we already have, and that's assets associated with estate, but also workforce and pieces of equipment, to look at actually how we best utilise those assets to make a cost-efficient pathology operating model. It's Liverpool Clinical Laboratories, Alderhay, St Helens and Wiston, Warrington Hospital, Arrow Park and the Countess of Chester. There's a huge amount of work to do. It's a challenge, but I think the challenge is real, but I think it also with that challenge comes an opportunity. That opportunity isn't for me particularly. The opportunity, I think, is to provide a sustainable footprint moving forward, such that actually pathology is something that actually people want to come here to train, they want to come here to work, and that actually moving forward LCL is at the centre of that. The pathology network, as people will be aware, is an emerging network, mainly from the NHSI piece of work that was done a number of years ago, which looked at the Carter reforms and how they were being implemented across England and Wales. And because of the patchy implementation, models were put forward in terms of proposed efficiency savings that could be made by further consolidation and collaboration. The network is in the early stages. We have a team and a programme team who work on it, and we have a transitional management team which is looking at the best way to deliver pathology across Cheshire and Merseyside, utilising the assets that we already have, including obviously a very skilled and well-rounded workforce, but obviously it isn't just about making sure that we consolidate where possible. It's about looking at the sustainability of the network moving forward, putting pathology at the heart of new models of care, making sure that pathology is seen as a value proposition rather than a commodity, and ensuring that clinical quality and access to diagnostics and new diagnostics is at the centre of the way that we move forward. There is pieces of work that's ongoing which actually doesn't really matter where tests are done, such as procurement across the network. We're looking at workforce, including skill levels, but also looking at development for staff and making sure that they can develop appropriately within the confines of the network. We're looking at demand optimization, so making sure that we're doing the right tests at the right time. We're not doing too many tests and causing harm, and we're not doing too few tests or the wrong sort of tests and missing diagnoses. And that piece of work again is really independent of any operating model for the future network. We also want to look at new technologies and ensure that we are early adopters of those technologies and make sure that they work appropriately in the setting for pathology moving forward. I think another big area that we obviously want to look at is point of care diagnostics. Obviously most people are aware of point of care diagnostics. However, we have lots and lots of experience of fragmented and inconsistent implementation of point of care. And again, it's about putting diagnostics in places out in the community to ensure that people get the correct diagnosis and that it avoids hospital admission or it helps with chronic patient management. And I think these are some of the challenges that obviously the network is going to address. Well, as I've been appointed as clinical director for the network, obviously I will have to and will be expected to do more work looking at the way that the network works, ensuring that we have the clinical quality maintained or improved, and therefore I will be probably reducing some clinical commitments for LCL for a small period of time, probably 1 or 2 years, whilst we get the network up and running and more sustained and more stable. It's equity of services across the patch. It's doing the best and the best pathology that we can deliver and putting it at the heart of new models of care to ensure that diagnostic pathways are as efficient as possible, and that pathology is at the centre of that, and that we're doing the right test for the right patient at the right time and in the right place. And that can go from a very simple test all the way through to the most complex molecular test that we can possibly do. But all of it needs to have value, and all of it needs to have an understanding of its part that it plays in terms of patient pathways.